still no deal. Negotiations are continuing as we speak here in Montefiore, but in Manhattan at Mount Sinai, we are told that negotiations didn't even happen. Neither side even came to the table today. More than 7,000 nurses are on strike, went on strike for the second day today, and they say it's not about the money. It is about the nurse to patient ratio, which they say is so bad, it's dangerous.
It's insane, it's chaotic. Every day is like a humanitarian crisis.
Emergency department nurse William Indick would rather be inside Montefiore treating patients than standing outside protesting. But he says the hospital's staffing situation is so dire, he didn't have a choice.
It's jammed rail to rail, stretchers right next to each other. There's no infection control. On the critical care side, you're taking care of like 6, 7, 8, 10 patients. And then on the non-critical care side, it'll go up to like 20.
Right now, there are more than 700 open nursing jobs in Montefiore and 550 at Mount Sinai.
In the year that I've been there, we probably had enough nurses. Probably, let's say, 5 times for argument's sake. Attorney General Tish James is calling on the state health department to enforce safe staffing laws, and the nurses union wants that clearly spelled out in its contracts.
Staffing enforcement language. We need that. We need the staffing. We need to care for our patients safely.
In a statement, the Greater New York Hospital Association says, quote, study after study has shown that not just New York, not just the U.S., but the entire world is experiencing a major nursing shortage. It is irresponsible to talk about hospital staffing issues without acknowledging the immense challenges hospitals face, especially a shortage of nurses, as they try to recruit and retain their nursing workforce. Transplant nurse Mary Fitzgerald begs to differ.
Montefiore is notorious for short staffing. They will say we can't find anybody. That is false. We know nurses from the community and from around the state that have applied to get here, and it's crickets. They hear nothing.
Without safe staffing, nurses say they're worked to the bone, unable to provide patients with the care they deserve.
A human being can only do so much, you know, when you're pressed for time, you know, and so we're just running and gunning nonstop as fast as we can.
Now, until something happens later tonight or into the early hours of this morning, nurses will be back in front of both hospitals striking for a third day tomorrow from 6 a.m. until 7 p.m.